Good morning, everybody. We had some questions for how we treat different conditions. Today we're talking about headaches. So headaches can be a symptom of almost any type of issue or problem going on in your body, everything from dehydration to a lack of salt to you haven't eaten in a while, so you got a blood sugar crash. It could be a lot of neck tension. Now, of course, you're entitled to as many problems as you darn well please, so we start with a thorough consult and exam to make sure we understand what you're dealing with, what you want out of your health, and then what your objective starting point is from the exam standpoint, so we can actually help you get to your health goals. So let's talk about more like tension headaches, another type of headache called cervicogenic that comes from your neck. A lot of people don't know that joint problems in your neck and shoulders, this is your shoulder blade over here. It's obviously a very accurate representation of someone over here. There we go. So you can have problems as far down as about your, I'd say T6 to T9 area. You have muscles that run from your head down to here, and from your neck, they kind of go like this. So that tension can just bound up and then cause headaches that are right at the base of your head, right over here. If you have trigger points or problems that are in the top of your trapezius muscle, they can refer up over the top to the base of the skull, right over here, over the ear, and pull at the back of the eye. Hurts a lot. We're going to be doing some videos about that. But as far as treatment goes, the number one thing that we need to do is we need to do a zone analysis. The zone lets us know of the 6 sets of body systems, which ones are the most stressed, which ones need the most support. Each one of those is correlated with certain levels of the spine, so we know exactly where to adjust. We'll do a zone analysis and an adjustment. We'll do myofascial therapy. This is super important to be able to release trigger points and muscle tightness. If the muscles are too tight, they jam up the joints. Then the joints don't move right, then they inflame the nerves. Inflamed nerves tighten the muscles, which lock up the joints, which house the nerves, which run the muscles, which tighten up the joints. So when we interrupt that cycle at every single step, you can be certain that you're going to get really good results. So the myofascial therapy, we can't call it massage in the state of Texas. There's a whole thing about that, so we have to call it myofascial therapy. And so that helps the muscles relax. And then we use red light therapy. Now, this is one of the things that sets us apart from a lot of other offices. Red light therapy has been standard of care in a lot of European countries for 60 or 70 years, and it's making its way over here into the United States. So it's not a new technology, it's more new to this area. Phenomenally successful. A lot of applications, not just for humans, but also for in the veterinary space for animals. I digress. The red light therapy helps to decrease the inflammation, helps to decrease pain, and helps to speed up healing by about 2 times. And so this is a really phenomenal thing that we can do, especially for people who are really sensitive, who have either neuropathies, who have fibromyalgia, who have headaches, who have muscle aches and pains. It increases the blood flow, increases the oxygen delivery, increases the energy production by your mitochondria. All of that fancy stuff to say decreases inflammation, decreases pain, speeds up healing by 2 times. So if you have joints that aren't moving correctly, which inflame the nerves, which tighten the muscles, which tighten up the joints, we interrupt this downward spiral at every single step and allow your brain to be able to talk to your body properly. Additionally, if you need traction therapy, we can recommend a device that you can take home. This saves you a ton of money. Every traction therapy session in other offices might be billed for somewhere between $50 and about $120, depending on, well, how bougie the office is and how high of opinion they have of their services. We can provide a device for about the cost of one of those treatments, send it home with you, teach you how to use it, and you can get yourself 30, maybe 40 sessions in the span of a month for the price of one treatment with our expertise. It decreases the amount of time we have to spend with you and allows you to get in and out of the office faster, decreasing the load on your schedule, and then also allows you to have a skill and a tool to be able to take care of yourself if anything were to pop up in the future. So it just really goes back to making it easy to help people get better faster and stay better longer. And so when the neck and the mid back is moving properly, it's adjusted properly, the muscles are calmed down, the nerves are calmed down, and any kind of traction is provided, the body calms, it heals itself like it's supposed to, and those headaches go away. 85+%. It's really phenomenally successful protocol.